Hi everyone, and welcome back to the GuideWell Connect Insights Lounge here at day one of the AHIP Institute and Expo. I'm here with my colleague, Mr. Mark Stryker.
Hello again.
With our new guest, Mr. Russ Thomas. Russ, welcome to the interview.
Thank you, great to be here.
Well, Russ is the CEO of Availity, and I know that you have a wonderful relationship with Mark, so I'm excited to have the conversation that no doubt might have a few laughs in it too. All right.
Not from me, of course. But
yeah. So we'll start on a serious note,
Sure.
Russ. You know, in today's clinical environment, health practitioners can easily be overwhelmed by the amount of data that they're expected to capture in the back end to satisfy quality requirements and quality measures. How does Availity simplify that workflow?
Yeah, so I think it's a great question. I think the emphasis is on the word workflow. The way these processes have worked historically, right? The sort of antiquated world that we live in today is there's nothing about the process that operates in the workflow. It's all retrospective, it happens after the fact. Providers are asked to disrupt their business cycle during the day and go pull these charts from print charts or even electronic charts. They're all being done after the fact, right? And that's not a workflow solution. A workflow solution is when you deliver these requests for information and you extract the information in their actual process of seeing patients, right? So think about it. At the same time, a provider is answering the question of, who is this person coming into my office? Are they eligible for healthcare services? How do I know that they're an insured, that they have a deductible? Use that opportunity in the workflow to serve up that request for additional information. Russ Thomas is coming into your office this afternoon for an appointment at 3 o'clock. Here's his eligibility information, and oh, by the way, if you complete this risk assessment, you can actually now do it in the workflow and make it seamless and easy for you as opposed to having somebody show up in your office a month from now looking for these little data elements.
So clearly you must have listened to the provider side, right, and you identified the friction points and really tried to solve for that by delivering that point solution, well, not point solution, right. You delivered the solution at the time that the provider or the payer, because I know that you work
right.
with both, really needs to access that particular piece of information.
Exactly.
Yeah, so a smart
exactly
way to solve for it,
yeah,
right?
Yeah, absolutely.
Okay, so let's say that we have Availity and you offer these wonderful solutions, yet we know that health plans have a limited budget.
Right.
What is it that you say to a chief information officer about your solution and convince them that this is the right thing to invest in at this time,
right.
and what kind of return they should expect when they do?
Yeah, so one of the great things that we're seeing now in healthcare is a move away from the build it here, right, kind of mentality. We're working with some very innovative, creative leaders in health plans, including technology executives, CIOs and CTOs, who are looking at their legacy systems and coming to the conclusion that a lot of these systems weren't built for today's information demands. And so we're consistently finding ways to work with our health plans where and how they work today, right? To build capabilities around those transaction systems, around those adjudication systems, and more often to pull those information requests or those capabilities into what we call our gateway, right? So let's eliminate, one of the things that just frustrates me about healthcare is so much of the information sharing that happens is retrospective, after the fact, latent. And if you listen to providers, what they will tell you is, we're more than happy to collaborate and help solve these problems, but give us the questions, give us the demand for information when and how we're working, right? Not in a letter that you send me 30 days later looking
Sure.
for a piece of data. And what we're finding with our health plan partners is that they're getting a lot smarter on how they leverage a network like Availity. One of the other nice things that we see is a tremendous amount of collaboration among health plans in solving these problems. I think there's been a realization that, even if as health plan A, I won't pick on anyone, but I might have the best set of capabilities in the market, but if it only represents 5 or 10 or 15% of the provider's daily patient flow, they're really not going to change their workflow for that, right? So we're seeing really good collaboration around solving these problems in ways that allow our plan partners to be very successful and achieve scale, but then to differentiate in areas that are important to them. And that's where the world is going, we think.
So when you are working with an executive team out there, give us a sense of the customer journey, your client, basically, the before and the after, because it can be a long sales cycle, it can be lots of machinations within legacy systems and all that. What's the before and the after, though?
Yeah, it's not unlike the stages of recovery of addiction, I think. Sometimes, the first step is admitting that you have a problem, right? And I think that we're pretty good. And I would say, Mark, that desperate times call for desperate measures. And I think, one of the things we've seen over the last few years is the demand to reduce overall administrative cost within the health plans is paramount among all of our plan partners. And so where we've gotten a lot smarter as a company is, we really start the dialogue around return on investment, right? Savings, and not savings that you achieve 2 or 3 years down the road, but if we implement a capability with you today, and here's what that journey looks like, right? And we try to make that journey as simple as possible and as short as possible. But if you implement this with us today, then here's what you can expect, not in the next 3 years, but in the next 12 months, right? In the budget cycle that you're working in to achieve in terms of economic return. And then, the icing on the cake, we think, is, at the same time you're achieving a better economic return, you're also doing a lot of things to make your provider network and ultimately your members happy. And the other comment I would make on this when you talk about the journey is, the journey for us used to be a pretty administratively oriented journey, right? So, we'll get your claims processed faster. We'll help your providers get paid faster. Where we see the world going is that journey is really a holistic view of what's happening in that relationship between the plan, the provider, and the patient. And one of the things that I think has a lot of potential, but also a lot of risk is, as we move into a very consumer engaged world, right? Whether you do that through a high deductible plan or through, more aggressive care management, whatever it may be, we got to make sure along that journey that we're enabling consumers and their caregivers, right? Whether it's, their primary care doc, their specialist, or their physical therapist with the same information. Because you can create a lot of damage and a lot of risk, frankly, in those relationships if you're sharing one set of information with the provider, right, and another set of information with the patient. I'll use one specific example and then move on, but think about something as basic as your prescription history, right? So wouldn't it be great, and we can do this, right, to be able to serve up to a physician in real time before the patient walks in the door, here's a complete record of your patient's prescription history, what they've been taking, what they're compliant with, where they may have misses, where they may be duplicate therapies or, contraindicated medications. Well, that's great, but let's make sure that the record we're then sharing with the patient through their personal health record is exactly the same. Otherwise, you've got a mismatch of information and a real disconnect in that provider engagement. And that, I would argue, in some cases is worse than nothing. So, but I'm an optimist. I think sort of everybody who knows me knows I'm a, glass running over optimist about things. And I think the future's bright from this perspective.
Well, I wanted to jump in real fast and say, I monitor a lot of social conversations, Russ, on behalf of GuideWell and GuideWell Connect, and patients, people who happen to maybe have a health episode that makes them a patient, but they're very interested in really owning that data.
Right.
Not just having access to it, but really understanding it. So I think too that it's not just the access to it, but it's the dialogue that then happens as a result of it. And that's really something that Availity is empowering both really the health plan, the provider, the consumer, and that's where traction finally happens. And that's where we really start to see that population health needles begin to move.
And I would say to you that, remembering that we're at the AHIP conference, right? We're here with health plan leadership. As a patient though, right, as an insured, I'm actually growing to expect my plan to help manage that for me, right? I don't want to have to go chasing information at my kids' pediatrician and at their specialist and at all these different places, right? I feel that as part of what I'm purchasing, when I'm acquiring health insurance, that the plan should be coordinating not just the information, but coordinating care on my behalf. And ultimately where I think this goes, and what I'm probably most excited about is, at the same time they're coordinating my care, I want my health plan to give me resources that let me make better buying decisions, right? We talk about transparency in healthcare, and transparency is as much about making good economic decisions in the process of acquiring healthcare as it is, getting the right caregiver, right? And to me, that's sort of where the bar starts, is making sure as a plan that your network is complete and full of good quality providers. But ultimately, I'll use my own situation. If I have to go get an MRI, I want my plan to help me decide whether I want to go to the hospital and get it and pay one price, or Do I want to go outside of the four walls of the hospital?
And understand
Go
the
to the
implications
local
of
and
it.
understand the financial implications of doing that. And if I do go outside of those walls, to help me share that information back to my specialist, so I don't have to go chasing information down.
And I wanted to just jump in too. I mean, it's not just informing them with price point, but it also is the quality behind where those procedures are done too. So it's truly an informed decision.
Yeah.
Right. I'm sorry, Mark.
Well, not at all. So in the past, in healthcare, we've talked a lot about patient-centered medical homes.
Yeah.
Do you think we need a patient-centered technology home
Yeah,
or transactional home?
Yeah. Mark, I think a lot of buzzwords get thrown around, right, in healthcare. Healthcare has more buzzwords and terms, and what's the flavor of the month, right? At the end of the day, I think you're onto something. I think at the end of the day, we need a resource for consistent information sharing between all the stakeholders in healthcare. I think that companies like AvailT, I think our company in particular, has an important role to play in that, right? To assure that information is communicated effectively, which to me means both accurately and timely, and in a trusted way. And security, we think security is important in a world where we're moving administrative data.
Right.
Now as we really start to move clinical information, is there anything more personal to you than your health record? You have to have that kind of trust, in a network. And then we're a distributor, right, of information, and whether it's distributing it to my personal health record or my place that I go as a patient, or to the providers that are caring for me, I think there needs to be a single place where that happens.
So within that, then, Availity got a long history with our organization, right? Spun out of Florida Blue years ago, and has now evolved into a place where many different health plans from all across the country that compete in a local and national market. Availity's kind of evolved into a bit of a safe harbor from a transactional standpoint, even from a functional standpoint. What's the future of how Availity is going to partner with the disparate breadth of organizations and capability providers?
So I think one of the things that so if you look at Availity as a network today, right, we have we're at 1 million now, providers who day in and day out use our network. So 1 million providers on the network, 500,000 unique logins and unique users every single day, right? We're running 9 million transactions a day across our network. And that has brought a lot of health plans to us, because I think there has been a recognition that, to the point I made earlier, right, I might think I do some things slightly better, but the reality is, in my opinion, right, there's not a single health plan in the country today that's differentiating in the way their business grows, or in their basis of competition is not in how they serve up, core administrative data, financial data, and ultimately, I think, clinical data. And one of the things we're proud of as a company is, and we saw this just 2 weeks ago at our board strategy meeting, right? So we brought in executives from all of our owners, our investor plans, right? Which is Anthem, Humana, Florida Blue, HCSC, and Blue Cross of Minnesota. We brought in a couple of our great business partners. We have a fantastic relationship with Optum now, as I think you know. We had representatives there from some of the other plans that we work with, and we sort of convened this forum where our plan partners see what we're doing with the providers, and they listen to us really represent the provider network that we serve as to what's important and where the market is moving. And my view and what we hear is there's a greater demand for collaboration across this functionality, sort of core and growing functionality than we've ever seen in the market before. And whether that means moving clinical data and getting smarter about the way that we transact ADT data from hospitals back into plans, or again mentioning Optum, our relationship with the ACE editing engine, really making our gateway the place where plans and providers edit their transactions as opposed to doing it in these legacy adjudication systems. That's where the market is moving from our perspective.
Right.
Well, it sounds to me like the collaboration and that feedback loop that you're providing is only going to make all health plans really stronger and really strengthen that connection between the provider, the payer, and ultimately the member.
Yeah.
So I think Availity is in a wonderful position to do that. And thank you so much, Russ, for sharing your time and your expertise and your insights with us. Mark, I think that we're going to be ready for our next interview in just a moment. Great. So hope that our viewers keep watching here, us at the GuideWell Connect Insights Lounge. We'll be up again in just a moment.
See you shortly.
Thank you.
Thanks, Russ.
Good.
Thank you. Yeah. Have you stay here.